guys, welcome back to Medical Coding with Blue. Today's episode is all about, can you get hired with a Cpc-A in the medical coding field without experience? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so the CPC, the Certified Professional Coder, is an outpatient medical coding certification with the American Academy of Professional Coders. This is their flagship credential, right? And with this, if you have never worked in the medical coding field, they attach an apprentice status to the CPC. So you'll be a Cpc-A for the first 2 years that you have it. Now, if you are going through an approved AAPC program and in conjunction with PractiCode, there's that thing where you can, as soon as you complete all of that, you'll be able to have a full-fledged CPC once you get done with it. You can also, once you start working, once you get certified, and you start working in medical coding, if you do PractiCode in conjunction with that first year of coding in medical coding, then you can get that apprentice status removed once you complete PractiCode. And once you've completed that full year, the first full year of medical coding, you could totally do that. The problem with this is, guys, even if you start out with a CPC, you still have no experience. And the fact that people get so discouraged because, oh, I have a CPC-A and no one wants to hire me. First of all, we have to lose this defeatist attitude. There is a lot of that, and it is rampant. I mean, people, I don't know if people just expect things to just be like, you know, a really easy going in, or maybe that's what the school sold them. But I'm here to tell you that it's not that easy. But the things that are the most wonderful in life are the things that you have to really work for. Because if this was easily handed out to everybody, then everybody would do it, okay? So not a lot of people do it. The industry loses a lot of really good talent in the first 2 years because people get frustrated and they can't find a job, or you know, they start working and it's not what they want to do and that kind of thing. So there's a lot of talent that gets lost. But I'm here to tell you that if you truly are serious about getting into this field, you absolutely can get hired without experience. How do I know? Because I did it. I have been in the medical coding field since 2008. I have gotten my first job through the temporary agency. It was a temporary agency for medical professionals, and there's tons of them out there. Don't ask me which one I went through, because unless you live in my hometown, it's not going to apply to you. So you can Google in your area temporary agencies for medical professionals, and you'll see all these listings pop up. I did that for the city of Dallas. I am not in Dallas, but there was a lot of them out there. And being that you have no experience, you have training. That's already going to put you ahead of the pack, right? You have training, and people actually get hired even without certifications. So the fact that you have a CPC-A, I mean, you have a CPC-A. I mean, a big deal, right? But that's not what's stopping you from getting a job. What's stopping you from getting a job is your defeatist attitude and saying, oh, well, I have an apprentice status, that's why no one wants to hire me. No one wants to hire you because either you're not putting forth the effort, you're maybe just kind of looking for only entry-level positions, which you can't do. Because if you are certified, this says that you have the entry-level competence, or just the competence in general, to do medical coding. So you want to make sure that you start to change that mindset, okay? It's not because you're an apprentice, but because you have to have a really good resume. And there are a lot of terrible resumes that I see out there online, right? I'm on LinkedIn for the show, and I see lots of people complaining that they can't get a job, and they post their resume. And their resume is 3 or 4 or 5 pages, and it literally has nothing to do with anything that they learned in the school. 3 or 4 or 5 pages, to me, if I am a hiring manager, let's just pretend, and I see a candidate with 3 or 4 or 5 pages, I'm immediately rejecting it. I'm not even looking at that particular candidate, because number one, a resume should be 1 page, but no more than 2 pages, okay? And at that, you have to add on everything that you were trained in the program. Now, I have put out my videos several times about what to do for your resume. And if that's where you're getting hung up on, you can certainly check those out. Look through my videos, guys, and you'll be able to see I give tons of advice. But if you want to send it to somebody to do for you, like, write it for you, a professional, there's tons of professionals on LinkedIn. I'm a resume writer myself. My rate and contact information is in the description box below. But just make sure that when you're farming it out to somebody that's a professional resume writer, make sure they have medical coding experience. Because if they don't, they're not going to really understand what we do. I've seen examples of professional resume writers who have no experience in medical coding, and you can tell because they'll put things like ICD-10. To me, if I see ICD-10 only on a resume, that's your skill, ICD-10, I'm immediately rejecting that because you didn't specify CM or PCS. There's two things for ICD-10. So that's why you have to be very specific. This field in medical coding is about specificity. If you are not specific about the skills that you have, meaning that you put on there that you're organized, you're a team player on your skills list, again, another reason for rejection, because that's not a skill. That's a soft skill, but that's not your hard skills. And only your hard skills should be on your skills list. I'm just saying. But you want to make sure that when you're out there and you're applying, that you're applying for those places that are even asking for experience. And even if they say we don't hire Cpc-A's or even CCAs, the CCA is a Certified Coding Associate with the American Health Information Management Association. Even if they say that, go ahead and apply anyway. What are they going to do? Not call you? No one's already not calling you if you're not applying everywhere, okay? So make sure that they know who you are, right? Because they're not going to know who you are. A job is not going to show up at your doorstep and be like, hey, I'm here because I know that you're a medical coder. No, a job is going to fall into your lap once you start being out there actively and applying for jobs and making sure that you put out there what you know and your availability. And so that's the important thing. When these employers put out these job listings, of course they're going to say, we want people who have experience. Why do they say this? Because they don't want to have to train you. They want somebody that's going to be able to get in there and get going. But it doesn't mean that you don't have that competency to be able to do that. Even veteran coders still have to be trained when they get on the job with their electronic medical record. Not necessarily coding training, because that's not what they're doing. But they are showing you how to use the electronic medical record, which is what you can get if you are a brand new medical coder. So don't be fearful of applying for these jobs, even though they're asking for experience, 3 to 5 years. Somebody who's a veteran coder and somebody who's a brand new medical coder, if they're given the same medical coding test, right? Because they will test you when you're out there and you're trying to look for a job. When they give you this test, and let's just say, for instance, you take the test and you do really good on it, and that veteran coder didn't do so well on it, which is a possibility because sometimes veteran coders get very complacent in where they are. They get rusty on different specialties, and maybe they get just proficient in one specialty. And so in order to have more opportunities, you want to make sure that you're always staying on top of everything. But somebody who's a brand new medical coder has just been freshly trained in all of the specialties. And so if you do really well on that medical coding test from the employer, who do you think they're going to call back, right? The person who passed the test versus the person who did not pass the test and who has experience. I'm just saying. So you have the chance to do that. And happy coders, I've said this in many of my videos, happy coders will stay where they are when they are happy. And they're not going to be out there looking for a job. So the employers are going to be at the mercy of whoever is applying. If you are not actively applying, they will not know who you are. Okay? So that's why I'm telling you, you have to make sure that you're putting out those applications, you're putting out those resumes, and a resume has to look good. If you have a terrible resume, it's going to show. It's going to show with the responses that you get from the employers, okay? So make sure that your resume looks good. Again, go through my videos. But don't have the defeatist attitude of, oh, just because I have a Cpc-A, that's why I'm not getting hired. It's not because of that. It has a lot to do with where are you applying as well. And when you are out there applying, and maybe you're only looking up medical coder, but you're not looking up other names. So there's a ton of names that they call coders. You just have to learn to look at the job listing itself and what does it say. Sometimes we're known as revenue cycle technicians or revenue cycle tech, medical records technician. There's a ton of names for us. Health information technician. Sometimes it's just coder. Sometimes it's medical coder. And even though we are medical coders, sometimes they refer to us as coders. Coders, when I think of that, those are software coders. That's something completely different from what we do. That is really not what we do at all. We work with the medical records and things like that. That's what we do. And we translate that information into codes. And we apply critical thinking, and we apply that knowledge that we've gained in the school. But you know, the beginning part is where it gets really tricky, because this is, again, where a lot of people kind of fall off. And especially if they get around people who have the same defeatist attitude, then all of a sudden you're all singing the same song, right? Everybody can't get a job, and nobody can do this, and nobody can do that. That's why I tell you all to stay out of the Facebook medical coding groups. I have a Facebook page for the channel because you all asked me for it, and I resisted, but you kept asking me, so I have one. There's not a lot that goes on there, but I did it so that you all could have a place where you could talk to each other, but no one talks to each other, you know. So but it's out there. But I don't really believe in Facebook, because there's a lot of ignorant people on Facebook where they're just saying all kinds of stuff because they think that they know, or maybe their experience is because of this and that. And somebody who maybe has a background that is not so clean, if you know what I mean, those are the people that they don't get hired, because, you know, we have to have clean backgrounds, all right, in everything. And so sometimes when people can't get hired because of that, they will say, oh, well, I didn't get hired. And then it discourages another person who's hearing this, because they don't know any better. They're just listening to what's out there, but they don't know that person's story. So maybe they're just believing what that person said. And then all of a sudden everybody's just giving up. And then you wasted all that money. And then you get mad about wasting the money because you went to school. When instead, all you have to do is stay focused and stay out of those Facebook medical coding groups or any of those other groups that you're in where there's negativity, and you go and you concentrate on doing what you need to do to be able to get in. If you need to start in medical records so that you can work your way in there, that's totally fine. If you need to start off as a medical biller is a great place for brand new medical coders to start, especially a Cpc-A, right? Because you have medical coding training, okay? Somebody who's in medical billing does not have to be certified in billing, which is crazy to me, but that's just the industry and the industry standards. But somebody who works in billing, who's been trained in medical coding, is going to be able to understand when the denials get to them, right, to their desk. They're going to understand why, okay? The insurance company says that a modifier is missing. It should have been a HCPCS procedure code instead of a CPT code because of the particular insurance company that it is. And or there's only so many units that you can use, but a trained medical coder is going to be able to understand that. And a trained medical coder is going to be able to, when they're transmitting all the codes and pushing it on through to the insurance company, they're going to be able to catch any potential errors before they get to the insurance company, which is another great thing that a certified medical coder can bring to somebody's business that's medical billing, okay? So that's the thing. I think it's very helpful, but you have to be very, persistent with your search. And that's one of the great places to start. Prior authorizations is another great place to start, because you're not actually coding, but you are talking to the insurance company. You're saying that the provider wants to do this particular procedure for this patient with this condition. Is it approved? Is it not approved? This is where it's supported, right, in the documentation. And the insurance company will say yes or no. But that'll give you exposure to codes, exposure to the electronic health record, which is what you want, okay? Electronic medical record, electronic health record. But that's what you want to be able to add to your resume. And where you start off is not where you're going to be permanently forever. So even if you start off a little bit less than you thought you were going to start off on, because maybe the school sold you that you were going to be able to make a lot more in the beginning, If you start off at a little bit less, it's okay. You're not going to stay there forever because you can always move on once you start gaining experience. You do not have to stay loyal to the first place that you get hired on at, especially if it's paying a little on the lower side, okay? And every place pays differently, or it just depends on where you are in the US. That's why I never give dollar amounts specific on my channel, because sometimes people get locked into a certain dollar amount and that's all they hear. They don't hear anything else. And unfortunately, that's the way some people are. And no, we're not doing that here. My channel is about getting y'all motivated to be out there to get your medical coding job and to stay on the right course with learning medical coding and all of the things that go along with it. Okay, that's what I do here. So some of my stuff that I say is a little bit of tough love, but it's because I want y'all to be prepared and not be so shocked when you're out there and all of a sudden you're not getting hired. Why are you not getting hired? Let's look at the resume. Let's look at how are you passing these tests when they're giving them to you. So that's the other thing. Sometimes when, let's just say that you got your resume going out really good and they call you and they say, okay, well, here, take this test. And then you take the test and they say, okay, well, we're sorry, you failed it. Now, they won't give you the answers most of the time on why you got it wrong or which particular ones you got wrong, because these are specific to that facility. And if one person gets the answer key, then all of a sudden everybody's going to know, and they're not going to really be able to tell if the person really understands what's going on at that particular facility or not, right? So they'll tell you that you failed. And a failure may not be as bad as you think. So let's just say their passing score is a 95, right? And let's just say you got a 94 and they tell you that you failed. Okay, well, you only missed maybe one or so, you know. But if that's the case, then, you know, you can ask them, you know, I know I failed at this time, but is it possible that I could take it again because I was just nervous, or I'm just really excited, and, you know, I would just really appreciate the second attempt if I could. And you can ask them that, guys. It's a conversation, okay? But don't go begging them. Don't be emailing them 100 times to see what your score and you know, how you're doing and that kind of thing. But be reasonable with your communication with them, okay? And make sure that when you take the test again, sometimes the people pass it on the second try, and then sometimes people fail it again and even worse. So just make sure that you're taking your time and you're really looking at it. If you feel like you didn't learn from the school, which you should have, and that's part of what you're struggling with, that you really don't know what you're doing, and maybe they told you at the school that you are going to learn on the job, which I hate that. There are some things that, yes, you're going to learn on the job, but when it comes to coding, you should be able to understand the fundamental basics for you to be able to get out there and to be able to do it on your own, you know, and then learn it along the way. Just like the nuances and stuff. That's what you're learning along the way, is those nuances. But for the most part, you should be able to understand the fundamental basics of all of the books, how to look up the codes, where to look up additional information should you need to help you to further understand if this is the correct code or not, whether it is diagnosis or procedure code, you know. So that's the other thing. But that's my message for today, guys. CPC-As do get hired. CCAs do get hired. And just because an apprentice is not a part of the CCA, okay, I'm just going to say that. The CCA is a Certified Coding Associate, and that is a credential with the American Health Information Management Association. That credential says you know how to code inpatient and outpatient. So there's a lot to that credential, and there's a lot of ignorance out there about that credential, which upsets me, because as a former CCA who had it for many, many years, I will say that when it comes to that credential, a lot of people overlook it because, again, they don't know about the credentials and understand what they mean. The CCA just says that you have entry-level competence to code inpatient or outpatient. It has the most domains of all medical coding certifications, and it is very difficult to pass. You can look at the AHIMA pass rates, and you'll be able to see that. The actual scores for the last 3 years, you'll be able to see those. And it is a very challenging exam. But it is possible to get hired with it. Same thing with the Cpc-A. It is possible to get hired with it. It's just you have to be willing to say, okay, I know there's going to be some rejection, but it's not going to be all rejection if I keep applying. And apply with the temp agency. It's not like Manpower where you're only working for a day. Temp agencies for medical professionals is going to be those assignments that are maybe contracts that are maybe 3 months long or 6 months long. And all of that experience you are going to be able to add to your resume so that you have some sort of traction going and with that resume. So that's the thing that you have to look at. You may not start off at the highest thing that you want to, but you have to work for that just like everybody else did. Okay, at least that's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Guys, stay positive and get out there and stop thinking that it's just because you're brand new. This happens to all of us, and it happened to me. It happened to thousands of others. But if I had given up, I would not be here telling you not to give up too. I'm just saying. So with that said, I'm going to wrap this one up. If this video helped you, please like, subscribe, and share. And I will see y'all next time. Bye.